Being at Kaiser Permanente, I was actually have been able to kind of grow and do my life's work here. And presently I am the medical group administrator. And that means it's a job of kind of trust and influence and support. And I get to work with all of the physicians and their staff and the community.
Outside of our organization, I believe she's been a model leader for advocating for health issues within our community, not just cancer care. And I truly believe with her work with the Healthy Marin Partnership, it's really been the appropriate approach to look at health issues not in terms of treatment, but in terms of prevention. She's been active with the Healthy Marin Partnership since its inception. She's been in leadership positions, I believe, since she's been active with the Healthy Marin Partnership. And I think the philosophy there of that organization really aligns with our organization in that we truly believe it's important for people in healthcare to address root causes of problems, not just dealing with the acute episodes. And I think her presence on that within that organization has really been a very positive presence for our organization in this community.
We really became much more educated and much more strategic as a group in looking at the total health of the community. And in doing so, the first thing we looked at is what were the key diseases in Marin. And actually in most communities, heart disease tops the list. But Marin County, heart disease does not top the list, cancer does. And one of the things that is near and dear to all of us in cancer is breast cancer. So breast cancer in and of itself is a major focus of Healthy Marin Partnership. It's really important for organizations like Kaiser Permanente to collaborate, particularly organizations like Zero Breast Cancer. Recently there was a forum where our own Mary Marcus participated in the forum, and there was a segment on breast cancer in the Latina woman. Kaiser Permanente really is concerned about vulnerable populations, and Latina women are vulnerable for a few reasons. Number one, that the rate of breast cancer for Latino in Marin is significantly more than their counterparts in the rest of California. And also they have their risk profile is similar to white women in Marin County who are the leaders in breast cancer.
She's been very active in the community with organizations such as Zero Breast Cancer that I believe are extremely important work in looking for the causes of cancer to prevent cancer and not just simply focus on the treatment of breast cancer.
I'm very proud of the people who work at Kaiser Permanente and care for our patients throughout the whole spectrum of breast care, from prevention all the way through to people that are diagnosed and treated. These people work tirelessly, and my job as medical group administrator is to work as tirelessly as they do on that very issue. My job is to make sure that everyone has everything that they need and want. Sometimes it's actually providing, sometimes it's being the cheerleader, but most of the time it is standing in awe of the people who actually do the work. I see recognition as a point in time. It's a time to reflect back on what has happened, what you've done, what your organization have done, what the people that work with you have done. And basically it says, okay, so what are you going to do now? Recognition is actually a form of leadership, and with leadership comes responsibility. So this just means that we have to be that much more responsible, we have to be that much more active, and we have to be that much more a part of the community, continue collaborating. So basically it's a vote to carry on, it's a vote to do more, to better, harder, and I think that Kaiser Permanente and myself are very happy to take on that new responsibility.